I have been the former president of the Indian Academy of Pediatrics. And today we are going to discuss about the ways to boost the immunity of a child by natural means. And it's very interesting to know because quite a few parents, when they come to our clinics, usually they ask us, sir, my child doesn't eat. मेरा बच्चा बिल्कुल नहीं खाता है. उसका वजन नहीं बढ़ता है. His height doesn't increase. He is repeatedly sick. बार बार बीमार पड़ता है. And these are very common questions for which a pediatrician gets quite a few parents lining up the OPDs. And many times I wonder whether there is a real answer for these queries. Okay. So quite a few parents ask me, sir, हमारे बच्चे की immunity तो अच्छी है ना? Whether the immunity of my child is fine. And then I start wondering as to how to explain what is this immunity. Because it is very, very, very difficult to understand for a common man as to what is the immunity in the human beings. Basically, remember that when we are born, we have some mechanism to protect ourselves from infections from outside. For example, skin is an excellent barrier. Okay. There are some cells which in our medical terms, which we call as T cells and B cells. Okay. And these are called lymphocytes. They are the cells in the blood. And usually they are responsible for producing the immunity in the body. So there is some protection which is, achieved by the baby from the mother. And after giving vaccines, you know that बच्चों को हम टीका लगाते हैं in the first year of life, right from birth till the child grows up to 12, 13, 14, 15. We keep giving vaccines. So giving vaccines is another way of giving immunity to the child. So now you are clear that there are two types of immunities. One is natural from the mother and second is acquired, okay, through the vaccines. With this, the body is ready to fight for infections, okay. So whenever there is some virus, for example, rotavirus, or a respiratory syncytial virus, meaning thereby even if there is some virus entering either through the nose or through the mouth, then our body is ready to fight with that virus. Same is true for influenza, same is true for COVID-19. And in case if the body has not received adequate training in the form of natural immunity, what will happen? Basically, body will fall ill, sick, okay, and the person will get recurrent infections. बार बार बीमार पड़ेगा, recurrent diarrhea, बार बार दस्त हो जाएंगे, okay. So this repeated illness, बार बार बीमार पड़ना, is one of the indicators of poor immunity. Poor immunity. Some children, they get repeated cough and cold. Some children get repeated discharge from ear. Some children get repeated diarrhea, so on and so forth. However, whenever a child gets infection, जब भी संसर्ग हो जाता है, infection हो जाता है, at that time the body will produce some antibodies. Antibodies are the products which will remain in the blood to give protection to this child for a long time, And all these antibodies are nothing but proteins, okay? And these proteins are the ones which are ultimately responsible for the manufacture of those antibodies which are going to protect us. So if we come from top to bottom, it is the natural immunity, it is the acquired immunity, which is through the T cells and the B cells, and the antibodies, which are nothing but proteins. So ultimately, it boils down to one important fact, that if we have good quality proteins, our immunity will be excellent. Okay, that's why we must have good quality proteins, and that's why the doctors and the nutritionists and the scientists have given us certain food groups, and there are 7 food groups. Okay, first is of course cereals, okay, like rice and the wheat. Secondly, the pulses. Then we have the milk and the milk products. Then we have vegetables. We have fresh fruits. We have egg and other fleshy products which are under the non-vegetarian source. Okay. And the most important in the group, which comes right at the beginning of life, which is mother's milk. Okay. Remember, when a baby is born, the baby receives mother's milk, and this mother's milk has all the properties which would fight the infection till the baby is exclusively breastfed for the first 6 months, 180 days of the life of the child. No infection can touch the baby unless the baby has some other serious congenital disease, which usually is not a very common thing. So breast milk is the first. And then we always remember that we have rice and dal as combination, because rice has some amino acid which is lacking, and dal has some amino acid which is complementing the rice. So the rice and dal combination together is the balanced diet. And that's why the importance of balanced diet. Balanced diet, we say samatol ahar, balanced diet. And whenever we have our diet, in the food plate, we have some 50 to 60% carbohydrates, we have some 20 to 25% of fats, and the remaining as the proteins. Okay. So if the diet is balanced, usually we have a very, very good combination of all these food groups that I told you, and the immunity is excellent. But what happens as the child starts growing? Child comes to know from the ads on the screen saying that this is the chip, this is the potato chip, this is something where it is very, very tasty, and then he starts eating junk food. And junk food does not give balanced diet. Okay, so that starts eroding the immunity. Okay, because the balance is lost. And that's why the most important thing is, whatever the child receives, it is rice and dal, add a bit of ghee to that. Okay, it becomes a combination of carbohydrates, proteins, and fats. And I always say that there is one word which all our parents must remember, and that is prashad. Pra is proteins. Okay, prathin. Okay, sha is shakkar, and the is from the med, that is the fat. So all these three have to be there. Whichever food which is consumed by the child must have all these three components in a proper manner, so that the child gets a balanced diet and a good amount of nutrition and immunity. What is immunity? Nothing more than this. Okay, so through the natural means of these 7 food groups, we have got all the first class proteins. Remember, my dear friends, the white of the egg is the one with which all the other proteins are compared. And that is why the best protein to compare with is the egg protein. So if a child receives the white of the egg, provided there are no other religious or other social restrictions on the diet, then he is getting the best A class proteins or the first class proteins. Okay. And those who are strictly vegetarian, they can have the combination of rice and dal. There are things like soya bean, which have very, very high quantity, good quantity of proteins. Groundnuts have good quantity of proteins. And that's why be on lookout for items which have good number of proteins, good quantity of proteins. Along with this, of course, when a child is growing in a positive atmosphere, remember there are some 7 alphabets in the English literature, from A, B, C, D, E, F, G, and each of them have some meaning in the life of an individual and also in the life of a child. So A is the atmosphere around the child, which has to be always positive. B is something to be beware of the bad, like the pollution in the atmosphere. Okay. C stands for the company of the child. Okay, the friends who are amongst the child. D is the diet, which has to have vitamin C from the fresh fruits and the fresh vegetables, vitamin D from the sunlight, and that's why 40% of the body must get exposed for 40 minutes in a daytime, and particularly in the time of 11 a.m. to 3 p.m. Okay, and that E stands for exercise. You must see that the child takes an exercise which will make him sweat. Okay, so in the evening, you are not going to sit at home, but you are to go out with the child. He is running on the ground, you are also having a brisk walk. Both of you get a good exercise. And for those parents who ask me, sir, my child simply does not eat, I tell them there are only 2 tonics in the world. Number 1 is an exercise. till the child sweats. And second is a pat on the back. Always praise the child for whatever good things he or she does in the school or at home. Okay, and then that F in the alphabet list stands for family. The family atmosphere also has to be positive, and the father should not criticize the food prepared by the mother. And G, of course, is the God, and you have to have faith in the God and in the guru. Okay, so these are all the 7 alphabets. So 7 food groups and 7 things and the ways as to how to live life basically will give you a lot of immunity. Some of these are having evidence, some of these may not have the evidence, but all in all, it is prudent and wise to follow all these principles. So let us have some questions from our listeners. As to Naina wants to know that the baby has become 2 year and 6 month old, and she doesn't want to eat anything and simply wants breast milk, and what to do. My dear friends, remember, in general, 2 years is the upper limit for breastfeeding. Remember that. Okay, a child gets all the things in the first 6 months of life, but after 6 months there is something called as a complementary feeding, which has to be diverse, and the amount also has to be good, and it should be having all those 7 food groups which I told you, and it has to be frequent. So all these 3 things have to be there in the complementary food, provided the child starts getting all these after 6 months. By the end of 2 years, the child should be off the mother's milk. However, after completion of 1 year, there are some problems, like the child has started teething. Okay, the mother has probably started going for the work, and that's why nighttime feeding can continue, because 30% of the nutritional needs of the child in the second year of life usually come from mother's milk. And that's why if a mother continues till 2 years to breastfeed the child, nothing is wrong. However, after 2 years, usually the child should start feeding himself or herself on own. Okay, and then our friend Priyanka, she wants to know that the 5-year-old experiences blocked nose very frequently, especially during monsoon, and how to prevent that. Remember, if a child has cold, cough, and mild fever, these are viral infections, and 8 to 10 viral infections in a year are absolutely normal. Quite a few parents are worried, and they ask me, sir, is it something to worry about? No. With each infection, the child is developing some sort of immunity, and maybe the different viruses will produce immunity in their own way in the body, and the body is now immune to fight the virus if it enters the body again. Remember that. And then Gautami wants to know as to what foods should be included in the child's diet to boost the immunity. I mentioned about the 7 different food groups, and now to elaborate more on that, remember that all the 3 colors of the Indian tricolor flag have to be there in the plate of the child. The topmost color is the orange color and papaya, and we have so many others which are orange in color, including the oranges from the fruits. They have a lot of vitamin C and vitamin A, and all the colored fruits in the food, they are definitely a part of those 7 food groups. And remember, many of the vitamin B group are a part of coenzymes which are required for many metabolic processes in the body, and that's why immunity highly depends on all those vitamins. The lowermost in the tricolor flag is the green color, and all the green leaf vegetables which have a lot of calcium and iron and fiber will be of great help for the baby. And the middle one is the white, which of course has milk and the egg, and of course the curds and the idli, and so on and so forth. So those are the products which will give you good quantity of good quality proteins. Remember, quality of proteins is extremely important, and you know that there is a circle with some spokes in the center of the Indian tricolor flag. Remember, that is the food plate with the fingers of the child, and that's why it's very important that the child eats with his own fingers from the plate. Remember, this is extremely important, and remember, all those 7 food groups should go into the plate. However, the vegetables and the fruits should be consumed along with the animal proteins and the products which have high class proteins. And then Archana wants to know, besides diet, what are the other changes could be made in the kids' routine to strengthen the immunity. Most important is the discipline. I told you the various ways to go around in the day, right, since morning. So discipline to get up early in the morning and have natural food items for the breakfast. Okay, the mother should take out a little extra time to prepare either idli vada or upma or poha, and not to push cakes and curries and biscuits and naan katai in the tiffin simply for the want of time. Okay, and then child must play very well in the school is not meant only for the studies but also for exercise. When the child comes home back, he also again must wash his hands and feet properly, have some good food, and then go to the playground. These days the tuitions and other things have, rather created a big problem, because children right from the school directly they go to the tuitions, and then the evening, wherein the persuasion of the hobbies and the singing and the dancing and the reading and the playground, they are all getting displaced. So the parents must see that these things are not displaced. All these are extremely important in the life, because we have seen in certain studies where those girls and boys in the 7th and the 8th and the 9th standard who play a lot on the playground and take part in the competitions of the sports, they are the ones who are toppers in the academics also. That is because the beta endorphins which are released during the play, they will make you happy for all the 18 hours during which the child or the boy or the girl, they are awake. And that's why, see that the child doesn't become a coach potato in front of TV. See that the child doesn't simply sit on the chair and keep on studying and mugging up tables, but he also goes on to the playground. And then Seema wants to know that her 8-year-old keeps on complaining about stomach pain repeatedly, particularly after the school has started. And how can I manage? Remember, first of all, see that the worms from the tummy are removed. Give him a nice dose of deworming medication as prescribed by your family doctor at night, and that will take care of the worms in the abdomen, so that after the school, quite a few times, children, they simply put things in the mouth without washing the hands, and then these worms, once they are out, they will not create this problem. And also, there are some who will always in the beginning of the year have some stomach pain, because internally their mind is telling not to go to the school. These are the children who have something called as recurrent abdominal pain, and on particular days, suppose there is an class of mathematics, or some child who doesn't like the class of say geography, then he will dramatize into inverted commas, of course, as if he has a pain in abdomen. So an older child above 7 years, 8 years, 9 years, beware of this entity also. Though, first of all, consult your family doctor, see that the worms are out, see that the amoeba is out, and then see that the child is otherwise okay, doesn't have fever, doesn't pass blood in the stools, and doesn't have very severe pain which makes him awake at night and all. And once the doctor is okay, he says no, nothing to worry about, then you please think about this psychological aspect also. However, the doctor will be the best judge for all that. And then Pooja wants to know that the 6-year-old suffers from cough very often and how to manage that. Remember, coughing is something, it's a very, 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 very common problem. And particularly in the rainy season, those who have a bit of a tendency for, asthma, okay, in case if the father or the mother have asthma in their childhood, or if they're allergic to the pollens in the atmosphere, then many times, this problem gets aggravated in the rainy season. However, please find out that in the house there are no pollutants which are called as indoor pollutants. Like, for example, on the bed sheet, there are some dust mites, and that's why please see that the bed sheet is dried after cleaning thoroughly well, and that will remove all the dust mites, which are common allergens. There are many allergens. Even if the father is a smoker, then the tobacco smoke, then the agarbatti which is used to let the mosquitoes get away, that's also the smoke from that creates a problem. If a child is going to the school on the scooter of the father and there is a exhaust from the truck in front, that's also an irritant. So all these problems are known, which are allergens. And that's why see that there is no factor like cement work going on in the vicinity or the paint work going on in the vicinity. And then please see that the cough is treated properly and these allergens are removed from the atmosphere. Sometimes it's very difficult to find out which is the cause, but it is important before you label a child as having something genetic like an asthma. Okay, and then there is a question from a mother as to what is the best lifestyle which a child can have during these days. My dear friends, the best thing these days which the pandemic of COVID has taught us is using a mask. Okay, it doesn't only prevent COVID, it prevents influenza, it prevents so many things. Okay, it prevents pollutants to enter inside, and along with a very healthy and good diet that we discussed, which is diverse, which has all those 7 food groups, and along with all those important habits related to the life, particularly the positive attitude, particularly a jovial and a humorous atmosphere in the family, a child who is not afraid of speaking to his parents, and who is having the appetite to eat because the mother has taken into consideration all the different food groups, and a mother who has vaccinated the child against all the important diseases. So my dear friends, I would always appeal you to give a very big consideration to the child. And what is big? Big includes breastfeeding and nutrition, I includes immunization, and G includes growth and development of the child. So look after all these three, and you will never face any medical problem as far as your child is concerned. Thank you.